I wanted to talk a little bit about how the post-traumatic symptoms are really great mimickers of other kinds of disorders. I think depression is the one disorder that practically everybody seems to be diagnosed with if they have, in fact, childhood trauma. So when we do the intakes, we're very careful to get as much information about the great variety of symptoms that people can present with so that we can start to figure out how to approach those symptoms. But we go for not just amelioration of symptoms, but for actual elimination of them. Now, some of the symptoms that are so difficult to have to deal with for people who have trauma-related disorders include impulse control, as I said, major depression, problems of not being able to get up out of bed and do one's regular activities of daily living, problems with intrusive symptoms, nightmares and flashbacks, and voices. We find that trauma voices are more common than voices from schizophrenia or bipolar disorder. Mood swings are a huge problem, and they're usually attributed to bipolar disorder. In fact, if you look at those mood swings and you keep a diary of when they happen, you'll see that it's more likely to be not a symptom of bipolar disorder, but a symptom of the trauma-related disorders. What is being seen as a mood swing needs to be understood that that's actually being triggered. So some fragment from the trauma has entered into the person's consciousness really quite unexpectedly, and then the person is triggered into feeling something very different than the person was feeling just a second before. And so those are not really the classical mood swings that we associate with true bipolar disorder. Some people think that a person suffering from post-traumatic stress disorder is simply not strong enough, that they're somehow morally flawed, that their character is weak. Well, nothing could be further from the truth, because it's not a weakness in character or some kind of inherent flaw in the person. PTSD comes from what happened to you. And there are overwhelming circumstances that will make the brain go offline, not because the person chooses to ignore or deny what's happening, but because that's just the way that we're hardwired as human beings. Now, a lot of people will say, well, why can't you just sort of pull yourself up by your bootstraps and go on, because bad things happen to a lot of people. Well, it's true, bad things happen to a lot of people, but when a person goes into what we call the instinctual trauma response, they really don't have a chance to make an informed decision. And so for people to criticize an individual who has a hard time recovering from trauma it's a very misplaced kind of judgmental statement on those people's parts. Willpower will not get you through your trauma treatment. Courage helps a great deal, but willpower is really a bit of a problem because too much emphasis is placed on it. There are people dealing with divided minds, quite literally, and you can have all the willpower you think you can muster, and yet another part of your mind is not able to go ahead and get with the program. Now, that's not something that needs to be, where the person needs to be criticized for it, but there are methods to use that can essentially do an end run around those problems. It's really important for people to understand how the addictive disorders intersect with the trauma-related disorders. There's an important phase of the instinctual trauma response, which is our model for understanding what happens to the brain when a trauma happens. And that phase is called self-repair. Now, self-repair might mean something like sleeping, or it might mean eating, or using drugs. And they might be prescription drugs, or they might be recreational drugs. And when people then get stuck in essentially the self-repair that seems to help for just a few minutes or a couple of hours, but doesn't help in the long run, they are tempted to try to keep using that same method. And so the addictions become the focus of a lot of treatment, but not the root of the problem, which is really the trauma. So there's a considerable overlap in the addictions, in the addictive disorders with the trauma-related disorders. We estimate that it's probably about at least a third, or maybe even as much as 2/3 of the people with addictive disorders actually have trauma at the root of those disorders. So there are certainly a lot of wonderful things that the 12-step programs have brought to the treatment of addictions. And those 12-step programs have proliferated to the point where they deal with overeating and with gambling and sex addiction. But they really are just sort of helping people manage, as they say, one day at a time. And we're looking for something that goes beyond one day at a time. We're looking at something, a process that will help people be able to live the rest of their lives with a more empowered sort of perspective, and with the idea that the traumas are truly over with. Many mental health professionals rely on the Diagnostic and Statistical Manual, better known as the DSM, which catalogs all the possible disorders a person can have. But of that huge book that's like the size of a dictionary, the most treatable of all those disorders are the trauma-related ones.